Welcome to the Digital Determinants podcast, where we delve into the complex, systemic reasons behind the presence of digital inequity and the challenges surrounding digital adoption within communities comprising generations from the Great Migration. This podcast will explore the impact of trust on digital participation, the implications of digital discrimination, and the unique challenges faced by descendants of the Great Migration in embracing digital technologies. Join us as we unravel the historical, social, and technological factors contributing to this phenomenon and explore potential solutions to bridge the digital divide and promote inclusive digital adoption. Welcome back to the Digital Determinants podcast. I am your host, Kyla Williams-Tate, and it has been a long time. And I have had to really take a moment because certainly as I am doing my level best to retell history, I am currently living in reality, and our reality right now is something I couldn't have predicted. Even with some knowledge about some things that were coming our way through governance, through oversight, through new leadership, this time has certainly thrown me for a loop. So I'm back because I have 5 more episodes of this podcast to deliver to you as a result of my Benton Fellowship project. And so this will be episode 6. There's been lots of conversation recently about digital literacy and digital inclusion is the superdeterminant of health. So let's revisit what we mean by digital literacy and why some researchers do call it a superdeterminant of health. Digital literacy isn't just about knowing how to use a smartphone or a computer or some type of technological device. It's the ability to effectively find, understand, and use digital resources to make informed choices, especially when it comes to health. And I think that this is something that's super important because when we talk about delivering digital skills and offering digital skill courses or workshops or experiences, it's just not about learning how to use the device. That's just one part of it. But the device and the thinking behind the person using the device is part of the digital literacy experience. So we have to talk about it holistically. And if you speak to any of the champions in this space, we always talk about it's not just about access, it's also about skills, it's also about infrastructure. And in Cook County, as part of our Digital Equity Action Plan, we talk about confidence because, again, you got to have something in you, a little zhuzh, a little, empowerment, a little motivation, a little curiosity, something that's going to push you towards using these devices or learning some type of new skill. Just imagine the person who's been really hesitant to jump into using technology, and now with AI and all the other emerging tech that is coming our way, people expect for folks to just be oh, okay, so now that I know how to check my email, I'm going to just jump right into the AI space. There's still a lot of confidence building that needs to happen in order to get people to move through the trajectory, the continuum of digital experiences. So we need to always keep that in mind. Throughout our communities, especially those shaped by systemic inequities, gaps in digital literacy can widen health disparities. Without the skills or reliable access to devices and broadband services, entire families are excluded from life-saving technologies. Researchers now emphasize how digital access, connectivity, and digital inclusion create a foundation for health, dubbing them superdeterminants. These factors are so critical because they do touch every area of modern healthcare: telemedicine, access to online information, and even reliable communication with providers. But to truly understand why this concept is so pivotal, especially right now, we need to trace its roots back to one of the most significant migrations in American history, the Great Migration, which, if you're following this podcast, the Digital Determinants podcast, you know we are talking all about the Great Migration and its relationship to digital inclusion, especially in those recipient cities like Chicago. You know a bit about the Great Migration if you've been watching this podcast, but for the sake of those who may be tuning in for the first time, between 1916 and 1970, over 6 million Black Americans left the segregation of the South in search of opportunity in northern cities like Chicago, Detroit, Cleveland, and Los Angeles. If you go to the Digital Determinants website, digitaldeterminants.com, there's a map there that I've placed that shows the migration of folks from the South, and kind of depending upon where you are located in the geography, kind of help to influence where you ended up in the migration cities, those recipient cities. So a lot of folks from Georgia, a lot of folks from Mississippi came into Chicago. Some of them even went further north and went to Detroit. So the migration patterns are evident on the map on our website. So check that out. While the migration movement opened new pathways, it also led to some profound challenges. And again, I've talked about this in previous episodes. When you get a lot of people coming to a new area and it's not planned, and you don't have the infrastructure or the governance or the policies or the processes, the placements like residences and jobs, like if you don't have all the things like available waiting for the people when they get here or when they got where they were going, then there's some challenges. There were some challenges. Cities swelled with new residents, many of whom found themselves in overcrowded neighborhoods with limited access to essential things like clean water and adequate housing and healthcare. For African Americans, these patterns were compounded by systemic racism and segregation. Again, watch episodes 1 through 5. There's lots of information that I've shared around what those conditions were and what African Americans did when they arrived in places like Chicago. Healthcare access in these cities were shaped by discriminatory policies and practices. Segregated hospitals and clinics routinely denied care to Black patients or provided substandard services. Many Black families relied on underfunded community hospitals and Black doctors, barred from practicing in white institutions, and they worked tirelessly in these segregated spaces. At the same time, public health campaigns and critical health information often failed to reach segregated neighborhoods, leaving communities disproportionately affected by chronic illnesses like diabetes, hypertension, and heart disease. Chicago, Detroit, Cleveland, and Los Angeles tell parallel stories of systemic inequity. It's so interesting that regardless of where they came from, where African American folk came from, and regardless of where they landed in these recipient cities, a lot of the stories are still the same. For instance, Black neighborhoods in Chicago, created through redlining and racialized housing policies, not only faced overcrowding, but also lacked basic healthcare infrastructure. And Chicago has some of the best hospitals and health institutions in the world. Similar conditions took root in industrial cities like Detroit, where Black workers were concentrated in dangerous, low-paying jobs that offered no health benefits. Meanwhile, in Los Angeles, healthcare deserts formed in South Central neighborhoods, creating lasting health vulnerabilities for residents. And for Cleveland, economic disinvestment in Black neighborhoods further compounded access to care. These historical inequities shape the high rate of chronic illness and poor health outcomes still visible today. The generational consequences of these inequities reveal an undeniable connection between systemic racism and health disparities. Descendants of Great Migration communities continue to face barriers to healthcare access. According to the CDC, in cities like Chicago and Detroit, African Americans experience higher rates of diabetes, heart disease, and hypertension, conditions rooted in the structural inequities of the past century. We're talking about more than just unequal access to hospital and doctors. It's about how systemic racism shaped wealth, education, housing, and technology access, factors that in turn shape digital inclusion. Think about this for a moment. During the Great Migration, Black families were often barred from attending well-funded schools or living in neighborhoods that would later develop the infrastructure for broadband and technology accessibility. Whatever digital divide exists today originated in these deeply unequal systems. Let me say that again, just in case you missed it. If Black people were prevented from being part of communities that were far more advanced and had far more resources to develop broadband and technology accessibility today, then whatever the digital divide that exists today is because of those deeply unequal systems of yesterday. Let's fast forward to the 21st century, and cities once synonymous with the Great Migration now face another kind of inequity, a digital divide. And it's a big old divide, y'all. Reliable internet devices and digital literacy skills are not distributed equally. Let me say that again for the people in the back. Reliable internet, that means strong upload, strong download, and affordable internet devices and digital literacy skills are not distributed equally. Research underscores that in neighborhoods where Black families were historically segregated, broadband adoption remains lower. These barriers to digital access directly affect health equity. For instance, without internet access, families can't connect to telehealth providers or access critical online health resources. And I use the internet and its online resources all the time to not only help me to navigate my own personal health, but to be a good, reliable resource to folks in my family and to my friends, to be able to use my general literacy skills and my digital literacy skills to help to be a liaison between those who don't have it. So if you don't have it or don't have access to it and don't have someone like me who is operating as a translator, then you are a digital translator. You are lost. You are lost. You are lost. And you are probably more than likely not as healthy or as well as you possibly or probably could be. This is why researchers point to digital inclusion, defined as access to broadband, affordable devices, and digital literacy support, as a superdeterminant of health. Digital inclusion ensures that people can participate in modern health opportunities, from telemedicine to managing chronic conditions with wearable tech and other kind of technological advancements that address health and wellness issues. When these tools are inaccessible, the gap in health outcomes widens, and those gaps often follow the very same racial and socioeconomic boundaries established during the Great Migration. You might wonder how the Great Migration connects to the recognition of digital inclusion as a superdeterminant. The link lies in the structural inequities that took root during the migration and linger on today. The discrimination that Black communities faced in housing, education, jobs, and healthcare didn't end when the migration ended. Instead, those systems have evolved, codifying a legacy of exclusion that modern technology has yet to fully address. For example, when Black families were excluded from wealth building opportunities through redlining, the effects rippled into the education system. Underfunded schools meant limited access to technology and learning tools, leaving subsequent generations at a digital disadvantage. When broadband infrastructure was introduced decades later, many Black neighborhoods in recipient cities were overlooked for development. Understand, broadband and access to technology is a business, unregulated business in a lot of ways. And those who are responsible for connecting the world got to choose where they did the connections. And if they felt as if there was no profit to be gained, then those places and spaces lack connectivity. And some of them still lack connectivity as a result of these decisions that were made decades ago. These inequities essentially block the descendants of Great Migration folk from accessing the tools essential to modern health. And yet, the resilience of these communities also sparked innovation. Black-led advocacy for equitable broadband policies and digital literacy programs are growing, and part of the reason why I'm here in Cook County is to help to bring more awareness, to share more stories, to help influence policy, and to help bring about opportunity and resources to ensure that no matter where you live in this county, no matter what you look like, what your name is, that you have access to all of the resources for you to be able to fully participate in a digital society. It really is that simple. We just want everybody to be able to get on and do things that they need while they own, okay? So as we continue to explore the concept of digital inclusion as a superdeterminant of health, it's critical to pause and ask a fundamental question. Are we addressing the symptom or are we addressing the cause? Digital access, connectivity, and literacy undoubtedly hold immense power in shaping modern health outcomes. But to view digital inclusion as the ultimate superdeterminant may ignore a deeper, more pervasive force keeping communities from equitable opportunities in the first place. So, is digital inclusion a superdeterminant of health? Or is systemic and structural racism the superdeterminant of health, which also influences the digital divide and the lack of digital inclusion? For Black Americans, the barriers to digital participation doesn't exist in a vacuum. They stem from centuries of systemic exclusion and deeply entrenched inequities. If we zoom out, zoom way out, the digital divide isn't just a technological problem. It's a manifestation of historical policies that denied equal access to, again, housing, education, healthcare, and wealth building opportunities. Redlining, segregated schools, discriminatory hiring practices are all part of a long arc of systemic racism that created the platforms for digital inequity today. It's the truth. No matter who is trying to retell it so it's softer, no matter who is trying to erase it from the history books so that people don't know about it. Those of us who are living and hear the storytellers, the folks who have experienced it, We know that this has happened and that this has impacted us negatively. It has caused such harm. So let's take broadband access, for example, the foundation of digital inclusion. Why do underserved areas in cities like Chicago, Detroit, and Cleveland often correlate with historically redlined neighborhoods? When infrastructure projects prioritized affluent suburbs and left inner city areas neglected, they cemented patterns of digital exclusion, and those effects persist. What if the barriers to digital inclusion aren't just about affordability or coverage? What if they are about the entrenched mistrust that exists because Black communities have been excluded from or exploited by systems for decades? Many residents of marginalized communities have good reason to hesitate engaging with online health tools when healthcare systems historically undervalued or even harmed Black lives. If systemic racism is the true root cause, then digital inclusion efforts, while vital and ones that I'm responsible for, are at risk of falling short unless we address the deeper inequities. Providing broadband access or teaching people to analyze online health information is essential, is absolutely essential. But it won't help if systemic inequities still restrict their ability to access quality health care, build wealth, or live in safe, healthy environments. To truly dismantle these barriers, we need a dual approach. Yes, we must continue to expand digital opportunities and ensure access to technology, but just as importantly, we need to confront and dismantle the structural forces that created these gaps in the first place. Digital inclusion alone cannot overcome systemic racism. It must be part of a broader movement towards equity and anti racism. This isn't an either or conversation, it is a call for a layered, comprehensive action. Digital inclusion amplifies opportunity, but systemic change is what clears the path for communities to realize those opportunities fully. If we want to create a future where health equity is achievable, we must tackle both. We absolutely must tackle both. The question isn't which superdeterminant matters more, it's how we prioritize both simultaneously to avoid treating the symptom while neglecting the disease. This critical perspective ensures that technological advancements serve all communities equitably and that no one remains locked out of the systems that shape their health, their future, and their well-being. Ultimately, if we want to close the gaps in health outcomes, it's not enough to champion digital literacy. It's not. We must recognize the role of systemic racism in creating the divide and address those barriers head on. Digital equity initiatives like expanding affordable broadband access and teaching digital health literacy are critical. They are absolutely critical. But they'll only succeed if paired with policies that combat the root cause of inequity, such as anti-racism measures and healthcare reform. The descendants of the Great Migration hold immense potential to thrive in a digitally connected world, but only if we ensure that they have equal opportunities to those tools. Digital inclusion isn't just about giving people internet. It's about reconnecting communities to health, wealth, and opportunity. What's the solution, right? And this is hard. I'm not lost on the fact that this is a hard thing to address. This is a hard nut to crack, especially in this politically charged environment where there's been attacks on equity-related programming and opportunities. But we got to do something, right? So here's a recommendation that I think can be helpful. We need to invest more in comprehensive, community-centered digital equity hubs. Champions, researchers, organizers, and elected officials should prioritize the establishment of these digital equity hubs, community-based spaces that are designed to provide marginalized populations with affordable access to digital tools, broadband, and health resources. These hubs should serve as one-stop centers where residents can gain critical digital literacy skills, receive support navigating online health services, and participate in initiatives that directly address health equity. So there's hubs happening all over the world. In Chicago, we have our original digital hubs, our libraries. We have some nonprofits that have computer centers, our community colleges, our universities. There are places and spaces that do this work. And part of my job in Cook County is to help to connect it all so that everyone understands how they can access the resources and ensuring that there is access in every place so that you don't have to travel 50 miles to get some type of support if you need it, that you can receive support and learn and grow in a digital way in your own community. That is part of our mission. A couple of key strategies to implement to ensure that that happens is ensure that all of the hubs are connected in some way, right? And we have some programming that's going to be coming out later this year in Cook County to ensure that all of our hubs are connected and that we're able to do a better job of data tracking around what's happening in those hubs and the folks that are being helped and supported in those hubs, because it's important. Certainly, there's a need to build technological opportunity and skills in marginalized communities. But as I said earlier in this podcast, we want everybody to be connected. Technology moves super fast. So even those who understand technology today are probably feeling a little lost with the technology of new. So it's a continuous process. Communities just need to have these hubs available so that people can learn in their own community and that there's support to assist in that learning and that they have access to the tools and devices to be able to, again, fully participate in digital society. So collaborate around resource development, which is what I'm talking about. Connecting all the people in places and spaces that do this work or have opportunity to do this work so that people in the community know where they can go for help, where they can contribute. Like, it's not just about consuming, it's also about contributing. Like, if you have a device that you need to donate to someone that's been sitting in your corner holding your dry cleaning, we can take those devices off your hand and we can refurbish them and send them right back out into communities so someone who needs the device and can't afford the device now has a device, right? So like, you don't have to just be a consumer in this ecosystem. You can be a contributor, and being able to collaborate around resource development is part of that. Another suggestion is policy advocacy for infrastructure expansion. The Cook County and the city of Chicago and surrounding counties in Illinois are all coordinating, trying to figure out how we address our infrastructure gaps. So advocating for policies that prioritize broadband infrastructure in underserved areas and unserved areas is absolutely vital and essential. Pushing for subsidies or programs that lower the cost of devices and internet service for those lower income families is absolutely part of this equation. When the Affordable Connectivity Program ended last year, I believe it's going to contribute to the largest gap in adoption drops that we've seen. So we saw such incredible adoption rates as a result of the subsidy that ACP provided, which significantly supports that affordable internet is something that is highly desired from residents in every community, even those who have the dollars to pay for it. I say all the time publicly, outside of my mortgage, my internet bill is the largest bill that we pay outside of our mortgage. It's more expensive than the food we buy. It's more expensive than car notes and car maintenance, more expensive than social activities, healthcare. It is our second largest bill in my home. I'm privileged, again, to be able to afford it, but if it gets too much more expensive, I don't know. And we need our internet. My husband works from home. I work from home from time to time. We have a very active and engaged child who uses the internet for school and his other activities that he's involved in. So affordable internet connections and reliable internet connections are needed. And we need those subsidies back so that we can get the folks who are no longer connected because they can't afford it to get back connected. The next suggestion is tailored digital literacy initiatives. Offer workshops that teach residents how to evaluate credible online health information, use telehealth services, and understand digital tools like patient portals or wearable health devices. Now, when I did this work back in 2010, 2011, we did a pilot project with Cook County's Fantas Clinic where we were teaching people back then how to use their health portals because, again, online health records were beginning to be rolled out, and that standard of care as part of a healthcare experience does rely on being able to check your health records or order your prescriptions. But if you don't have the digital skills, you don't have a device to do all of that on, then we're leaving folks behind. And I was doing that back in 2011, and it's 2025, and there are still people who are unable, to be able to access their patient portals or understand how to utilize a patient portal as part of their healthcare maintenance programming. So those tailored digital literacy initiatives should be tailored to meet the specific needs of seniors and our non-English speakers and other vulnerable populations. We don't talk enough about our veterans in this space. Veterans need support. What if they had access to their patient portals and where they are receiving their health care? It will help them to live more healthy and well lives. We need more tailored, specific digital literacy initiatives to speak to the multiple demographics of our population. The next recommendation is around community-based leadership. I speak about this all the time when I introduce myself. I don't just introduce myself, I also introduce that I sit in the office of President Toni Prettwinkle, our Cook County Board President. And that's important because she has prioritized digital equity, digital inclusion, digital opportunity as part of her policy platform. We have to have good leaders who are driving this work, and not just leaders coming directly from community, like our nonprofits and our hospitals and our schools, like our electives. We need our electives to have collective power and voice in this space. We want to encourage our local leaders and engage our local leaders to inform program development and ensure that initiatives truly address the unique challenges of our communities. We need to engage more grassroots organizations to co-lead efforts and act as trusted messengers. I'm so thankful for our Digital Equity Action Committee in suburban Cook County, our Digital Equity Coalition in the city of Chicago, our Council of Digital Equity, These trusted messengers is how we're spreading the word. It's how our ecosystem is growing. And then lastly, data and evaluation. I couldn't be a good research fellow if I didn't talk about a little data and evaluation. We need to measure the impact of how these hubs, these interconnected hubs, are improving digital inclusion and health outcomes. We need to focus on metrics like broadband adoption rates and telehealth participation and reduction in chronic health disparities. These hubs, these connected hubs that I'm speaking of, go beyond bridging the digital divide. They directly address superdeterminants of health by fostering digital skills and connectivity, which are necessary for accessing critical health services. Let me say that again. These hubs are going to go beyond bridging the digital divide. They directly address superdeterminants of health by fostering digital skills and connectivity, which are necessary for accessing critical health services. By embedding these hubs in historically marginalized neighborhoods and everywhere, and coupling them with meaningful community engagement, you create pathways to technological access and better health outcomes while combating the systemic inequities rooted in history, such as those experienced by descendants of the Great Migration. This recommendation, like this connected hub, this ecosystem that I am speaking of, calls for bold action and shared accountability to dismantle the barriers blocking marginalized communities and others from the digital and healthcare opportunities that they deserve. Again, equity. I know it's a bad word these days, but equity is ensuring that everyone can have access to it. Everyone can benefit from it. It means everyone. It really does mean everyone. So I don't know why it's such a bad word when we just want everyone to have access to the wonderful opportunities that technology and connectivity can provide, especially as it pertains to your health and your wellness. I want everyone to live long, long, long lives and contribute to society in the most fulfilling ways. I want the world to be full of joy, and having more joy means that you're going to have better health outcomes. You're going to have better health moments. Here are some final thoughts for the podcast today. The legacy of the Great Migration shaped the health landscapes of cities, again, like Chicago, Detroit, Los Angeles, Cleveland, many, many more. Now it's really up to us, and I don't mean the singular us, me. I mean the collective us, you two out there watching this. It is now up to us to ensure that the legacy transforms into one of empowerment through digital inclusion and literacy. Health equity is not just a dream. It's a responsibility. By focusing on both digital literacy and dismantling systemic inequities, we can move closer to a future where health outcomes are truly equitable for all. I want to thank you for joining me for this very passionate and spirited episode of the Digital Determinants podcast. If you found this conversation impactful, share it with someone who needs to hear it. And don't forget to subscribe so that you never miss an episode of the Digital Determinants podcast. Again, I got 5 more to do. This is 1 of 5. I'm counting them down before I'm done with my Benton Fellowship later this year. So until next time, stay curious, stay connected, and remember that health equity starts with you.